how long does it actually take for an L5-S1 disc herniation to heal? The truth is, most people have no idea what's actually happening in their body, and that misunderstanding can lead to months or years of unnecessary pain and additional fear. I've seen over 100,000 patient visits in this office, and I can tell you this, your disc injury is healing right now. But if you don't take steps to support that natural healing process, you could slow it down or even worse, make the problem worse. Now, there are many videos out there talking about the time it takes for a disc injury to heal, but not many actually take time to dive into the 3 natural processes that are involved in all such injuries. Knowing these 3 phases can be the difference between a full recovery and no recovery, ultimately leading to a back surgery. In this video, I will walk you through these 3 distinct phases and give you simple, safe strategies that you can employ through each of these phases to help encourage the natural healing process. Stick around to the end and I'll show you my top go-to supplements to support the natural healing process. Hi, I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. On this channel, I will show you steps to improve your posture and spinal alignment so you can move better, feel better, perform better, and have overall better health. If you've been told your L5-S1 disc herniation could take months or years to heal, you're not wrong, but you're not really aware of the full story. Healing doesn't occur in one big step. Disc injuries heal in 3 specific biological phases. Understanding the differences of these phases is really the key to ensure that you take steps to maximize the body's healing potential and lessen the likelihood of needing a surgery down the road while speeding your overall recovery process time. I'm going to show you what is happening in your body during the 3 distinct phases and what to do to help your body achieve healing the natural way. So phase 1 is the inflammation phase. This starts immediately at the time of injury, and it can last for as long as 2 to 3 weeks. Now, during this inflammation phase, that is when inflammation, you guessed it, is at its highest. There can be the most swelling, often the most pain. The biggest mistake people make here is they try to shut down inflammation completely to get out of pain, but unfortunately, that's the worst mistake that someone can do. And here's why. Technically, what's happening, when there is tissue that's damaged, there are chemicals that are released from those damaged cells. And the best way to look at this is if you've ever used a soaker hose in the garden. A soaker hose, you can see the water kind of permeating through the edges of the hose. Well, your blood vessels can actually change their permeability. What that fancy word means is they can become, like garden hoses, they can become leaky. So we have an injury, there's a disc that's damaged, chemicals are released. The blood vessels in that area get leaky, they change their permeability. That's how your body sends the reparative cells and other cytokines that drive this process. You have cells that are called fibroblasts, and they're trying to migrate to the site of injury. And here's the thing, it hurts because there's not space for all of that additional fluid and those cells that are trying to get there. But this is where pain is actually a good thing. When you're injured and you have pain, it's your body saying, hey, pump the brakes, we have to rest, we have an injury. When you try to shut down inflammation, you take ibuprofen, Aleve, aspirin, or more powerful agents like steroid injections or steroid medications. Those really shut down that chemical process. So those blood vessels technically don't get as leaky, and you're not actually sending the reparative cells to get to the site of the injury. So that's why so many people that rely on these anti-inflammatory agents, they feel better, but they're not actually supporting the healing process. And then the double whammy is because they feel better, they think that they're healed, and then they go do tasks that they wouldn't do if they still had that pain. So too much inflammation can be a bad thing because if you have too much fluid building up, that can start to hurt some of the healthy tissues. So how do you best manage phase 1? Well, you need to do smart conservative care techniques. So when we see patients that are in acute pain, we do gentle mobilization techniques to try to help the body move. Natural movement can act as a natural pumping mechanism to help flush some of that excessive fluid out without interfering with that inflammatory process. This is where ice is very useful. Ice Might not be fun to put on initially, but what that can do is constrict some of the blood vessels. So we're not getting as much flow, but we're not changing things chemically. Your body is still trying to send the right messengers to get the job done. So gentle, passive movements. We have people do gentle stretching that's tolerable. We never want to play no pain, no gain. We don't try to push through pain in the inflammatory stage. We try to ice, often 20 minutes on, 20 minutes off as often as we can. And then any gentle movement, passive knee to chest stretches. You can see some of our previous videos about safe exercise or stretches to do, but we want to make sure that the body is moving so we're not seizing up while not interfering with that inflammatory process, so the right cells can get to the site of injury for proper healing to begin. Because of the pain that inflammation can cause, this is the phase that people panic the most. They think they're broken, they're never going to heal. But now that you understand that inflammation is actually a good thing and that we need to support the right amount of inflammation, you don't have to be scared, you don't have to be in fear, you can take steps to encourage proper healing. One other note, they used to talk about bed rest. Bed rest was used all of the time for these types of injuries many years ago. But then when they actually studied it, they realized, wow, we're actually not helping the body heal just by being stiff and not moving. So that's why bed rest was thrown out once they actually looked at what happens when we do that. We want to be encouraging gentle, healthy movement, icing regularly, no heat at this point. That might feel nice when the heat is applied, but that can dilate blood vessels and bring more fluid into the site of injury, causing more pain in the long term. Phase 2 is the reparative phase. Now, this is the phase that typically starts around week 2 or week 3. Your body says, okay, we've got a lot of the cells that need to do the work to the site of injury. Your body was also working during that inflammatory phase on actually reabsorbing some of that damaged tissue. Kind of think of it in terms of house cleaning, cleaning up debris. At this point in time, the body starts shutting down that inflammatory phase. So we often start feeling better because we don't have that amount of fluid build up around the original injury site. Those fibroblasts, those specialized cells that I talked about earlier, they can come in and really start laying down the new collagen tissue that forms the basis of our soft tissues. Think about that as like the spackle that helps the disc to heal. Now, here's the danger with this part of the healing process. We start feeling better. So the problem here is that because people start feeling better, they think they have healed and that they are better. And this is the phase that has the highest risk of re-injury. Just because we're feeling better doesn't mean we've healed better yet. It's great that we don't have that inflammation still there from the initial phase. And this is where I tell our patients, I want you to act and behave as if you still had the pain. A lot of times, our to-do list may have been building where we were out of commission for 2 or 3 weeks. So there's a real temptation to be like, okay, I got to jump into that yard work or move this dresser that I wasn't able to get to. But no, would you do those things if you still had the severe pain that you had during the initial inflammatory phase? No. And if you wouldn't, don't do it now. So what do we do to support this phase, the remodeling phase? Well, in our office, we can start to do more traditional adjustments to make sure that we are restoring our normal movement patterns. This is very important. Probably 90% of disc injuries are caused by loss of proper spinal alignment. As we talked about in previous videos, we can have too much curve in the lower back. We can have too little curve in the lower back. We can have a reversal of curve in the lower back. We can have a pelvis that's not level. There could be a scoliotic deformity or short leg causing a tilt. And this is where chiropractic biophysics, which is the technique we utilize in our office, it's a form of corrective care where we start to work towards restoring normal alignment. Why? It's just a primary rule of engineering. Structure determines function. If we've lost our structure over time due to physical stresses, emotional stresses, even chemical stresses that can lead to stress on the body over the long haul, slips, falls, car accidents, work postures year after year, we have to take steps to move that structure more towards the ideal alignment, the way you were designed to be. And then that structure will allow you to function to a higher level without additional stress on the tissues that in many cases leads to the disc herniation. So that's when we start doing some corrective care protocols in the office. And at home, your homework starts to increase too. Now we want to do some light, gentle exercise. We want to do some more walking, 10, 15, 20 minutes, as long as there's no sharp pain. We're still icing, 20 minutes on, 20 minutes off. We can become more active with our home exercise program. We want to make sure that we're using tissues. So as we're healing, tissues are healing in a usable manner. Again, one of the worst things we could do is what they used to preach, just bed rest, and then oftentimes we can heal stiff or stuck or not in proper alignment. And then once we are healed and we start taking off doing things, that can lead to re-injury. So work in the office, work at home starts to get more active during this phase. How long does the reparative phase last? Quite a while. This can last 2 to even 3 months. So really keep that in mind. Okay, even at the 3-month mark, I might be feeling great, but there's a good chance that you're not fully healed at that point. So sometimes we really kind of have to keep it in first gear for a while. And think about some of the athletes that you may have watched over the years. This is where sometimes athletes will miss 1, 2, 3 months or more to make sure that they are healing adequately. Phase 3 is called the remodeling phase. This phase typically starts around month 2 or month 3. It can last as long as a year or even more. So at this point, the heavy lifting by the body has been done. We've cleaned out debris and byproducts of the initial injury. We've laid down some new tissue. We've spackled the walls, so to speak. But here's the thing. A lot of that new tissue isn't organized. It's not aligned into proper positions or alignment to handle the loads that will come into the body through daily life. So as you may have guessed, because that tissue isn't organized in an ideal fashion yet, even in the early stage of the remodeling phase, we are still at risk for re-injury. So now for the exciting part, how does the body take that new tissue and improve the alignment so it's better able to function more optimally? Well, this is great. Through the reintroduction of normal activities and getting more specific with our rehab will help the body to take care of this on its own. It's great, really. So what do I mean by that? Well, in the office, we start to look at the patient. We start to do more what's called like a return to play, return to practice. If there's things that they need to do, whether it's an athlete in their sport, or if it's adults that have simple tasks that they need to do as part of their home or work life, we look at some exercise that can start to mimic what those jobs and tasks are. And we start having them perform more exercise, adding loads to those exercises where it's TheraBands and maybe some small weights to start moving the body like they're going to have to move it in their sport or for their career or at their home, but in a safe environment where we can watch them and make sure that they are moving in safe and healthy ways. Now, this is the time where we can start to work back into the fold some heat. Oftentimes we're starting to be pushing the body a little more. We might use some moist heat to apply first before we do some stretching or some mobility work. And then after we're done working out, we can apply some ice, or we can alternate hot and cold. It's contrast therapy that helps to bring some fresh blood and nutrition into the site of new tissue. But then when we cool it after we heat, then make sure we don't end up with too much fluid after we're done working out. So contrast therapy can be very effective. 10 to 15 minutes of heat followed by 10 to 15 minutes of ice, and we can alternate like that. As I said, sometimes we bring in heat just to warm things up, loosen up tissues, ice when we're done. Those things really help the body to adapt to the additional challenges that we're going to be starting to layer in at this point of the recovery process. And when it comes to L5-S1 disc herniation repair, this is a great time to really start going after the more advanced core work. We want to work on core stabilization, train the body how to protect that lumbar spine when we are doing different tasks throughout our day or out on the field if it's an athlete. So now you know about the 3 phases of healing. I want to talk about 2 of my favorite go-to supplements for acute L5-S1 disc herniations. They are both whole food concentrates from the company Standard Process. The first supplement I like to use is Cataplex ACP. So those are foods that are rich in vitamins A, vitamin C, and then bioflavonoids, what used to be called vitamin P actually. So what those nutrients can do is help those small blood vessels that have been damaged during an injury, that are very active during the inflammatory process. It supports their health so they can do their job right, supporting natural inflammation without getting excessively inflamed. That can help to minimize some pain, although as we talked about earlier, we really don't want to cancel all pain, because then we fall into that belief of, hey, I'm better, and we really do need to take time to rest in that initial inflammation phase. The next supplement I like is Ligaplex 1. So those are whole food concentrates that have been shown to support the tissue in the disc. So whether it's L5-S1, whether it's a cervical neck disc, any disc injuries, Ligaplex 1 are whole food concentrate combinations that help to support the actual tissue that makes up a good healthy disc. So it's one thing when we have an injury, we want to make sure, hey, are we putting the building blocks inside with good sound nutrition? So those two supplements, Cataplex ACP, I tend to push early on in the inflammatory phase. And as inflammation drops and starts to lessen, then we maintain usage of Ligaplex 1, which we can start through early phase 1 inflammation. We can use that right through up to about a full year to make sure that that disc is really healing and is optimally nutritionally sound. So if you're dealing with an L5-S1 disc herniation right now, just know that healing is possible. Research suggests as many as 80% of all disc herniations, regardless of how severe they look on an MRI, have the capacity to heal on their own if you take the time to work with your body and support the natural healing phases. Now, of course, there are certain times when surgical intervention is necessary, particularly if you have any sudden severe changing of symptoms, especially if you have any difficulty with bowel or bladder control. That's one of these examples where we go right to ER evaluation. There can be a rare condition where we can have a piece of a disc that damages nerves that are important for controlling those functions. And of course, we never want to be without the ability to control bowel or bladder. So that's the one time when surgical intervention may be needed right away. Hope you found this video useful. If you or anyone you know is struggling with a disc herniation, hit the like button and share this video with them. If you have any questions, please take a moment and leave a comment below. I try my best to read and respond to all comments. The next video you should watch is 5 non-traumatic sources of L5-S1 disc injuries.